Welcome to Office Hours. Whether you're new to the acupuncture profession or have been at it for decades, this is the place where we discuss all things Chinese medicine and more. Join Toby Daly, a seasoned acupuncturist of the Som tradition, and Angelique Britt, a nurse turned acupuncturist who is brand new to the field, as they explore topics in and around the world of acupuncture and Chinese medicine. There's something for everyone here. Drop in anytime.
So I'm actually curious what and how you manage. I'm approaching the kind of unreal place of being fully booked and being fully booked a few weeks out, which is a new and different and strange experience. And again, I'm not throwing myself a party just yet. I'm at that place where I'm getting all of a sudden a whole bunch of new people. So I don't know if I'm at a peak right now and there'll be a valley later, or but it feels very much when I first started and started to gain some momentum. I have so many inquiries, and then I'm trying to schedule them in a mindful way. But I'm still finding that sometimes the patients I've been treating who haven't, for example, booked out are now there's no space for them. And that's an awkward conversation to have. And then I found myself squishing people into places where I don't like doing that necessarily and staying longer for some people just to make sure that care isn't interrupted. So, yeah, I don't know if I remember we talked about maybe an assistant being hired at some point, which I think would be a dream, except that I don't know for sure if this is my new normal or if this is just a peak and I don't want to pull somebody into my sphere that I might not be able to support for the long term and then be in a weird place that way. So, yeah, I'm just kind of juggling. And then I received an email that there's another practice that's going to be dropping a particular insurance and they have a multitude
Mm,
of patients that have this insurance. I take that insurance. There's only a couple of other practices. And so they're trying to find homes for them. And I'm like, oh my God. So I'm feeling overwhelmed by the volume all of a sudden, which
mm.
is new. And I guess I'm grateful that that's a good problem to have, I guess. But at the same time, I'm like, I'm like, whoa, because, I'm the one woman show at my place. So kind of my head's spinning a little bit. I'm feeling some of that like nervous sort of energy that I had in the very beginning. Any
Yeah,
sage
it's
advice?
certainly yes, it's certainly understandable. I've been through this. Almost certainly this is a peak followed by a valley.
Okay.
So you can comfort yourself a little bit with that because especially first starting, ultimately it will just be just peaks. And so then that's a little bit different conversation. But now you want to kind of weather this peak.
Okay.
How I do it is I schedule and leave one or two slots, that I can put somebody in comfortably in per clinic day because almost always there's something emergent. Almost
Mhm.
always there's something. And then again, sometimes people have to reschedule. So then that opens up another spot or two. But I always make a little bit of breathing room because I work with a lot of cancer patients. Almost always there's a crisis almost every clinical day. So I need those one or two slots. So I always do
Mhm.
that. So I recommend even as you are under pressure, try and put out, and this is another part of that, is try and put out new patients as far as possible to give yourself plenty of breathing room so you can take care of the patients that you already have. Again, I tried to treat everybody all at once, and when I first started, again, that really harmed my health, and I've learned I have a somatic understanding of that you
Mhm.
can't treat everybody in the world.
Mhm.
So you have to manage that well. You want to take care of the patients you already have, and have a little bit of breathing room for emergent things that are happening with your current patients. So that's my first recommendation. Second recommendation is, again, if you were thinking about going to all cash, eventually this will be a good push for you to do that. And then any practitioners newly graduated, you could bring into your office and then have them do the insurance for these people so they could learn that process. It would be great learning for them. Again, it would take
Mhm.
a lot of pressure off you. Again, something like that might be reasonable to do. Aside of that, aside from taking somebody into your office, again, local practitioners that maybe are new or have a little bit more space, then you want to make sure you have that referral network. I've got a few Sa'am practitioners near me,
Mhm.
especially patients that are like, I need Sa'am and I need it now, especially new patients if they don't want if they want to wait 3 months or something, that's okay. But otherwise, if they want something now, then I have some local practitioners that I can refer to. So again, this is a tough balancing act, but I think likely this is a peak and then valley. So yeah, don't do anything dramatic yet,
Okay.
but try and capture new patients, but just put them off a month, 2 months, and be ready if they're like that's too long. Then say, oh, you might want to consider these local practitioners. And again, if those local practitioners don't take your insurance, then they just have to wait for you.
Hmm.
but at least you're trying to help them get care sooner. But
Hmm.
some people personally will want to come to you, or that matches their insurance, and then they just have to wait because you want to take care of the patients you already have. So that's a good way of doing it. Just the new patients push off patients you already have, give a little bit of breathing space.
Okay. Those are good tips. I haven't had anyone be like, I need some now.
Okay,
That'll be a great
okay,
thing 'cause
that'll be
when that
next week.
happens.
That happens because this tradition sometimes is really potent, right? And so
Yeah.
when it's potent, then and they associate that with Psalm. And patients, they're not super educated, but they understand Psalm, and then something amazing happened to me, so then they demand that or something. So that may be happening soon with you.
Yeah. I don't feel confident enough to be able to be like, yeah, I'll just take all cash now. I feel
Okay.
not yet
But
there.
as you only peak, then you'll have to do something. So, but again, all cash is very comfortable, and then you just get rid of the entire insurance billing, which is just a sweet space to be in.
Yeah.
And then you just do everything all yourself, just cash. And then the other thing is when you get to full peak is then you have to get some help. Again, that is one of the smartest things I've ever done. And then again, you want to make sure that it's someone that's going to be able to really help you rather than harm you, which I think I shared with you before. I had people that made things worse, and I
Yes.
was paying
Yes,
them
you
to make
did.
things worse.
So how does one know when they're past the peak and valley point and at the point when it's time to make a move?
Wait for 2 or 3 peaks and valleys, and then you'll have a sense about it. Again, I think every practice is totally different. And let's say if it's a sustained peak for 3 months, I would say then that's just your new normal. But again, likely you'll cure some people, people will drift away or something, and then there'll be a little bit of coming down. As you stay in the same area for longer, it's coming up in 25 years for me, right? So then people know you. So then
Yeah.
you won't see them for 15 years and they'll reappear and things like that. So that gets even worse going forward. But especially as a new practitioner, right, it usually comes up like that and then it drops.
Yeah. This is the first
Usually,
time that this has happened since I've opened. Like I had a one of my had the newspaper article done on my practice just to like say, hi, I'm here. And I had this level of people coming at that time because I was new in the area and whatever. But this was unspurred by anything I did, you know?
that's not true. Anyways, you've been delivering clinical results at a reasonable price. So that's people can't help but talk about that.
Okay. I mean, but I didn't intentionally put out an ad or, do something
Nope. But this
marketing.
is much more effective.
Yeah.
This is what I had patients, right, scheduled for a knee replacement. You give them an acupuncture treatment. They get full range of motion and no pain. They're not going to keep that to themselves.
Yeah, that's true. That's true. Okay. Yeah, it's been a wild time looking at my schedule and just being like, "Oh my god," like, I had someone have to cancel an appointment for next week, but wanted to reschedule in the same week, and I was like, there's no space."
But again, someone that like in that case, then
Yeah,
you push them off and say, "Oh, you should have kept that." It makes your people really reticent to cancel and
cancel.
try and reschedule because
Yeah,
they realize that that's a valuable slot for you. So that's helpful a little bit training your patients too. Like it's very rare for me to get cancellations because they know. Again, my office manager Stephanie, she has like an algorithm, right? If you cancel, then you're way down the list, for getting back in. So it could be 5 or 6 weeks to get in again.
so don't cancel.
Yeah, so
Ugh.
don't get. I mean, it's training the patients to really respect your time because they may not get another shot at you for weeks.
Yeah, that's a good point.
Mm.
Yeah, so that just organically occurred with one patient. I added him. There's a waitlist function on the EMR that I
Yeah,
use, and so I just added them to their ideal time to the waitlist. But I now I have people like 3 and 4 deep stacked on my work days that are waitlist people because they aren't able to get in, which is great if I have cancellations because
Mm.
then I can just pull people from that list. So that's been really nice. I've
Does it
been
automatically do that?
It
Your
depends
scheduling, does
on
it automatically pull?
it doesn't. It depends on if
Oh.
you have to have formulaically added it correctly. So if the patient I have
Mm,
particular appointment times that I have set because I allow online booking, and it was complete madness when the electronic medical record, if you just say I work from 10 to
yes,
6:30, it would put people in kind of willy-nilly, and I'd have people at like 12:55, like who come no, absolutely not. So I had to have predictable
yes,
slots. So I built my schedule so that each appointment is its own like shift in Jane. And so unless a patient adds in the right parameters, it won't automatically pull them. But when they do, it does. It brings that person down and then it starts a
great.
timer for me where I have like 4 hours or something before it will release the slot to accept the patient into the slot.
Ah.
I have to confirm it.
That's it. That's interesting. You might at some point you'll have a human do this
I'll have a
because
human.
Stephanie, my office manager, she triages the patient too. She know yeah,
Yeah.
I've told her enough about the patients to know, oh, this person needs that slot, this person doesn't. If she's unsure, then she just finds me in a clinical room, lets me know
Hmm.
this is what the situation, and then do. Again, this is invaluable having a office manager that can do this. I think AI is good and probably getting better all the time, but again, it's nice to have a human in the loop for that.
No, I can't wait to have a human. I just don't know. I haven't reached, I'm in that middling ground. I'm in the true growing period of, okay, we might be approaching that time.
One more piece of advice, right?
Hmm.
As the peak comes, try not to stress out, and when the valley comes, try not to stress out. I
Do
spent
both.
so much time doing that.
I'm going to do
Okay, but
both.
again, just try at least try and remember my words when this because you're going to panic. Oh, too many people, and then you're going to be like, oh, not too many people. And then once you go through that cycle a couple times, again, if your practice is like a normal practice, you go through it a few times. Then
Yeah.
eventually you're like, okay, well, this is so great. I'm in a valley. I can study. I can. I mean, get caught up on your admin.
Yeah.
There's so much stuff to do. So then you
Yeah.
kind of look forward to those valleys, and then, like I said, at some point it just peaks. So then you have to figure out something out.
If I'm lucky, it'll just stay peaks.
Yeah, yeah. But again, people need Chinese medicine, and so once they find someone that can help them,
Hmm.
they continue for any Chinese medicine problems they have in the future, and then tell everyone about it. So that's usually that's what happens.
Yeah. And one of the things that I remember you telling me too is that people will pay for what they value. And
Yes,
I've noticed that more from people on both ends. Either they're willing or they're not. And it's like, oh well, I'm now seeing what you value. People who are saying they had a hard time paying for acupuncture, but spending $200 a month on supplements that
yes,
are silly. In my
yeah.
opinion, were silly. I was like, okay.
Anyways, we can use the term silly. We can substitute that for ineffective sometimes, right? So
Ineffective.
$200 a
Yeah.
month for
Yes.
ineffective things, or your services which can be effective. It forces people to decide again,
Yeah.
especially with limited budgets. Anyways, yeah, I think anyways, almost to a person, we provide such incredible value for people, especially when you look at biomedicine field, right? It's so crazy expensive. Somebody went to ER for a day and a half. That was recently told me it was like $200,000.
My God.
So I mean, and I mean, again, with sophisticated things, everything, of course, yeah, that's expensive.
Yeah.
But 200,000, I mean, it just seems insane.
It's insane. Well, that's like my quick update for now. So I appreciate your tips of advice. And for those of you out there that are in the same boat, I guess welcome to that boat with me. Let's ride it out together.
Yes. Well, again, you're starting to have good problems. I'm so happy to see that.
Thanks. We'll see how it goes for sure. I'll keep you posted. All right. Well, until next time.
Yeah. Everyone, take good care. Okay.
All right. Take care. Bye.
Bye.